Frostbite is it's an injury to the skin or body tissues that happens when these tissues are exposed to freezing temperatures or freezing conditions. It's essentially the death of the skin, either on the nose, the fingers, the toes. These seem to be the first affected areas, and it will depend on what type of exposure happens. But it's essentially when the exposure is so cold that the tissue actually starts to die from the exposure. Much like a burn or what we would call a thermal injury, which destroys the tissue, you could imagine that on your fingers, for example, if there was too much fire exposure, that could damage the fingers to where they couldn't survive. Cold can do the exact same thing. It's just the opposite extreme with the same effect, which is tissue that's non-functioning. The first thing you're going to feel is it's going to be exquisitely painful. Many of us have had situations where we're snow blowing and it's very cold out and your fingers just start to become, for example, really uncomfortable. This, as I say, this doesn't sneak up on you. At some point, it's actually when you start to lose sensation that you can understand there's no blood flow. Your body is just essentially cut off blood flow to these affected areas. You'll start to see skin changes that won't look like normal skin anymore because there's no blood flow. The blood flow is what keeps the color in the skin. So you'll see what we would call blanching or poorly perfused or poorly a skin that doesn't have very good blood flow, but that's when you're going to be well aware of the extreme discomfort that you're feeling as well. The way our bodies work, there's these tips of the body that the blood flow is getting, the vessels get extremely small. Ears are another one, by the way. Ears, nose, toes, and fingers are the classic body parts because they kind of stick out of the body. But certainly if somebody had some type of garb where their toes and their fingers and their head was covered but their knee was exposed, any tissue was subjected to it, but you would expect to see it in those kind of very small blood vessel areas like that first, and that's why we tend to talk about frostbite in those areas. Frostbite happens when several things occur at once. You need to have extreme cold. 25 degrees Fahrenheit outside, frostbite's extremely rare. When you experience these extreme colds, the amount of time that you need for exposure gets shorter. There have been more and more public service announcements about this, talking about minimizing your exposure. And I think people are rather adept at that. There is a certain luck involved because it can be the unplanned, it's often the unplanned event that leads to a true frostbite. We've been fortunate, apparently nobody has been driving through a rural area, run out of gas, gotten a flat tire, not had a cell phone, etc. Those are the cases where it can really happen, when you get stuck. Again, our body is pretty good at telling us it is really cold, I am getting really uncomfortable, I need to seek shelter. It's when somebody is either confused, intoxicated, and avoiding those cues, or they're just stuck somewhere without shelter. That's when it can happen. Thankfully, we haven't had that. But a foot of snow could make it easy for a car to get stuck when somebody wasn't expecting it. That could be a particularly dangerous combination. Being outside, as anybody knows who has been outside in the extreme cold, your body starts to act like it's running a marathon. Your heart rate goes up, your metabolism goes up just to create heat, try to offset putting off heat. And so people with chronic medical conditions of many kinds can really be placed under significant stress. We talk about heart attacks or heart disease with the extreme cold just because it's like you are suddenly running a marathon when you're in these extreme temperatures. People with chronic lung problems can suffer the same thing. Many people, many healthy people, they walk outside in the extreme cold and they just start to cough because it's such an insult or a shock to the lungs itself. So certainly anybody who wears oxygen at baseline or has some severe asthma or other chronic lung conditions can have a tough time when they're in situations such as this. And so the short answer is people with chronic medical conditions are going to be at some risk of getting acutely sick just because the environment is so stressful, it's so extraordinary. The number one thing we talk about often is when you're driving. When you're going to be driving in the cold, you want to make sure that you have gas in your car, because running out of gas in a remote area is going to be a bad thing. The vast majority of Americans certainly have portable phones or cell phones. Keep that on you and keep it charged. We have had cases where people have gotten stuck in the environment and they said, oh, I forgot my phone. I didn't remember to bring my phone today, or it wasn't charged. A phone is very valuable because it can get you out of this. And of course, appropriate clothing. People downhill ski in temperatures like this. It's all in what you're wearing. If you have the right gear on, you seriously minimize the exposure. So the bottom line is just understand what the problem is. It's a very extreme cold. And if you can minimize that exposure, minimize the chances of getting stuck in that cold, and have an out by using your cell phone, I think that'll keep virtually everybody out of getting into trouble.